Hi, I'd like to tell you about the pediatric diagnosis of Wilms tumor. It is also known as nephroblastoma, nephro for renal, and blastoma because it arises from embryonic tissue. It generally affects children under the age of 5, and it's the most common type of childhood kidney cancer, and it's the fourth most common type of childhood cancer across the world. The tumors usually present unilateral, but can present as bilateral. They are frequently able to grow without detection, so they can be quite large. The tumors can be quite large at time of discovery. The average weight is about 1 pound, but they have been found to grow up to 10 pounds. Prognosis is generally pretty good with a 5-year survival rate of 90%. The risk factors for development of Wilms tumor, any kind of family history. There's several genetic disorders and congenital abnormalities that can accompany Wilms tumor. Presentation is usually a unilateral painless mass that is discovered by the parent. It'll be found right along the costal margin. The signs and symptoms would include increased abdominal girth. The child will probably feel, rather fatigued. They might be vomiting. There might be microscopic hematuria when they do the urinalysis. Because of low erythropoietin levels, the child may suffer from anemia, which again would lead to the symptoms of fatigue. The child might have diarrhea, recent weight loss, and shortness of breath. It's very concerning in any child, any young child, if they have a fever and obviously hypertension from excess renin, so this child should be treated immediately. To diagnose Wilms tumor, you can see the mass via ultrasound, X-ray, CT scan, MRI, and IV pyelogram, and that allows the physician to see that there's an abnormality. Labs to confirm diagnosis would be a CBC, of course, to look at the red blood cell count from the erythropoietin levels, a chem profile, BUN, and creatinine to determine the kidney function. The urinalysis would determine if there's any protein or blood within the urine. With these children that are suffering from Wilms tumor, because of the detriment that decreased kidney function can have on overall health and well-being, treatment is rapidly follows diagnosis and confirmation that there's a renal mass, usually within 24 to 48 hours. Children are successfully treated usually with surgery, and they can have a nephrectomy. They're going to do a lymph node biopsy, and they might examine the rest of the abdominal cavity. Chemotherapy always follows the nephrectomy, and then radiation is added, like I said, in stages 3, 4, and 5 when the tumor has spread beyond the kidney. For the patients, because this is going to happen so rapidly, treatment follows so rapidly after diagnosis, it's really important to assess the patient's and the family's anxiety levels and to provide them that emotional and psychosocial support. You'll need to educate them on the etiology of Wilms tumor, any risks and benefits to the treatment, and the potential prognosis. This is where educational pamphlets can be used. You want to help the family prepare for any future clinical visits before and after surgery. Obviously, this is happening, quickly, so we need to, help them write down their questions that they might have and record answers so that they can review them later. You will need to discuss any side effects of treatment, especially with chemo and radiation that will begin immediately after surgery. For the pediatric patient, it's really important to discuss what is happening in an honest and age-appropriate manner. If there is a child life specialist on the unit, let's include them in patient education. And having to educate a pediatric patient within 24 to 48 hours requires that explanations are simple, repetitive, and focused on the actual experiences that the child is having. For older children, it's really important to provide them an opportunity to express their emotional feelings. They might be angry with how much attention they're getting over something that they don't really want to happen, over the extent of the treatment and the need to continually come to the doctors that might upset them. So play therapy and drawing can really help with adjustment to the situation. When it's appropriate after treatment, you can discuss with the child's family the lifelong increased risk for development of primary cancer and metabolic syndrome. For female patients, it's important, you can discuss with parents the potential for fertility problems after the use of chemo and radiation. And lastly, with your families, you really need to stress the importance of the routine lab work and yearly follow-up exams. It is possible, although rare, for a tumor to develop in the remaining kidney. And so if the parents discover a mass in the other kidney, they need to be seen by a doctor within 24 hours. Thank you, and that is Wilms tumor diagnosis.